Now, the function of the anterior pituitary gland, it of course synthesizes and secrete 6 major trophic hormones. Now, the hormones that we're going to discuss here are the 6 majors. Of course, there are many hormones to discuss, but these are the most common and most important, such as growth hormone. We have to grow. Prolactin, this is for the secretion and lactation, secretion of the milk, lactation. Adrenocorticotrophic hormone. Okay, this is a very long word, but all it matters is that we divide this into 3 segments. Adreno, that means the adrenal gland. We're going to cover that later. Cortico is short for cortisol or glucocorticoids. Now, this hormone is going to go to the adrenal gland, and its function is to secrete the cortisol from the adrenal gland. And of course, it's a hormone. Now, thyroid stimulating hormone. Again, from the name, thyroid, so it's going to the thyroid. Stimulating, so it stimulates the thyroid to produce its own hormones, which we're going to emphasize later in this lecture. Luteinizing hormone. This is the only way we could remember this is by the ovulation, and there's a very known graph for it. Is called the LH surge. Now, this is the concentration of the up here is the concentration of the LH, and here's in time, in weeks. Okay, so in the middle of the month, so here we're going to talk about from 0 to 4 weeks. That in the middle of this period, there's an ovulation happen. This happens in the menstrual cycle for women. Now, follicle stimulating hormone. This will be the related to the follicle, related to the formation of the and preparation of the oocyte inside the ovaries of the female. Next. So now we have to start with the growth hormone. Now, growth hormone is secreted from the anterior pituitary cells called somatotrophin or somatotrophs. Now, somatotrophs stimulates the growth of all tissues of the body, including bone. So bone is considered a tissue, yes, hard tissue actually. It is secreted in high levels during childhood, and it lowers when you grow up regularly. The growth hormone secretion is stimulated by growth hormone releasing hormones. That will be from the hypothalamus, and it is inhibited by somatostatin. Now, somatostatin comes from the pancreas, liver, even in our intestines, the duodenum. They secrete the somatostatin. Now, again, for anything in principles of endocrinology, we must say that each hormone or every hormone must be in adequate amount, not too little nor too much, just right. So deficiency of growth hormone would result in this image that we see here. As you can see, the normal height of this child is less than this child. So she has a deficiency in her growth hormones, which causes dwarfism. So the damage in the hypothalamus or pituitary gland during fetal development often results in dwarfism. But when it is too much, it it is from a tumor in the somatotroph cells of pituitary gland and sometimes lungs. Now we have prolactin. Prolactin is secreted from the anterior pituitary gland, of course, from cells called lactotrophs. Again, from the name, lacto means lactation. It promotes milk production in mammals in response to the suckling of young after birth. This hormone is regulated by dopamine, and this is secreted by the hypothalamus. It also estrogen increases the production of the prolactin. Estrogen also promotes the osteoblasts. It prevents osteoporosis. Estrogen also prevents osteoporosis. Hypoprolactinemia. Now, in order to understand what it means, we are going to crush it down into simple words. So, hypo means low. Prolactin is the name of the hormone, and emia means blood. So, hypoprolactinemia means that if prolactin hormone is reduced in blood. When it occurs, it leads in insufficient milk production after giving birth, which causes a lot of problems. So they have to, so these women have to have milk powder in order to compensate with the insufficient milk production she has. The hyperprolactinemia, hyper means high. Again, prolactinemia means high prolactin hormones in the blood. This leads to not only unwanted milk, but it's just a lot of milk production in the mammalian glands. This causes disturbances in the menstrual cycle, because estrogen is part of that menstrual cycle, and symptoms due to estrogen deficiency, because again, it is always a negative feedback loop. When there is more of prolactin, means the estrogen should be reduced, and when estrogen is reduced, osteoporosis can occur. Of course, menstrual cycles is again disturbed vividly, and so on and so forth. Now we're going to go for the adrenocorticotrophic hormone. Adreno means that it targets the adrenal glands. This hormone targets the adrenal glands. Cortico means that it will command these glands to secrete cortisol. And of course, the trophic hormone means it's from the pituitary gland. It is secreted in several intermittent pulses during the day and circulated around the blood. Its level is high in the morning and falls throughout the day. So as the cortisol, it also increases in the morning and falls throughout the day. It also increases production of chemical compounds that trigger an increase in other hormones, such as adrenal and noradrenaline. These are other kinds of functions that can interact with. It also can cause ACTH is not only secreted from the pituitary gland, it's also secreted in the immune system. We'll cover that in the adrenal gland lecture. Now, if we have deficiency in ACTH or deficiency in cortisol, it will lead to Addison's disease. Now, Addison's disease is not a very common disease, but it's very known in lots of books, from endocrinology books, and from this book that we have taken this source from. Now, when it is too much, it causes signs and symptoms of Cushing's syndrome. As we can see, the patients are easily bruised, and they gain abnormal abdominal weight gain and stretch marks on the skin. Of course, we see the round face and so on and so forth.